In this section, we're going to explore one of my favorite adaptive tools, intermittent hypoxia, which just means decreasing our oxygen for a short period of time. Challenging ourselves with low oxygen is a powerful tool because oxygen is the fuel for most life forms. As such, hypoxic stress is one of the most ancient triggers for adaptation. Our adaptive pathways get activated when our oxygen saturation drops below 90%. This can be easily measured with a pulse oximeter, but it's not required because once you feel the sensations of low oxygen levels, you will know when you are in a hypoxic state. Now, it's important to stress that the benefits of intermittent hypoxia come from a small to moderate dose of stress, meaning a few minutes. But if we exceed this dose by increasing the intensity or duration, trouble will follow. To clarify this concept, let's look at some real-life examples. In the large dose corner, we have obstructive sleep apnea. Obstructive sleep apnea is when a person stops breathing multiple times a night, and the severity depends on how many times a person stops breathing per hour. For these breathing fits to count, an individual has to stop breathing for at least 10 seconds. Now, this is alarming in and of itself, but what really stirs the pot of chaos is the frequency. It's not uncommon for individuals with obstructive sleep apnea to have 5 to 30 breathing fits per hour. And to make matters worse, our bodies respond to this threat by activating the stress response. This reaction snaps us back into reality by increasing our adrenaline and causing our heart rate and blood pressure to spike. Before we continue, it's worth mentioning that mild obstructive sleep apnea corresponds to 5 to 15 breathing fits a night. So assuming a person gets the standard 8 hours, they can expect to stop breathing 40 to 100 times every single night. And believe it or not, this falls on the low end of the spectrum. Just think about that for a minute. How would you feel if someone scared you during your sleep 13 times an hour? Exactly, you would feel like shit. This high dose of hypoxia is linked to high blood pressure, heart disease, erectile dysfunction, depression, cognitive impairment, and a reduced quality of life, highlighting just how destructive large doses of stress can be. Okay, let's shift our gaze over to the low-dose champion, intermittent hypoxia. Intermittent hypoxia involves cycles of hypoxia for a few minutes, followed by a re-oxygen phase for a few minutes. And the research shows that 3 to 5 cycles is the Goldilocks dose. Now, if you're thinking a few minutes of oxygen deprivation sound extreme, I got news for you. We are created in this environment. It turns out that our mother's womb creates a hypoxic environment for roughly 3 to 5 minutes several times a day, which just so happens to mirror the protocols of intermittent hypoxic training in adults. It's been proposed that these hypoxic cycles in the womb help the embryo develop its antioxidant defense system, which teaches our bodies how to put the brakes on inflammation. Another fascinating aspect of intermittent hypoxia relates to stem cells. Now, I'm assuming you know about stem cells' magical restorative powers by now, but just in case you didn't get the memo, let me bring you up to speed. Stem cells are the most primitive type of cell in the body, and they can transform into whatever the body needs. Therefore, we can think of stem cells as little transformers that can mutate into whatever serves the greater whole. I bring this up because cells thrive in hypoxic conditions. In fact, the hypoxia that occurs after an injury informs stem cells what tissues need to be repaired. We're having this nerdy discussion because a single round of intermittent hypoxic training has been shown to increase circulating stem cells by 51%. Now, this is relevant because many chronic diseases demonstrate chronic hypoxia, which needs to be fixed. And here's the short list: cancer, traumatic brain injury, lung disease, metabolic disease, heart disease, endometriosis, and inflammatory bowel disease. The good news is that intermittent hypoxia has been shown to treat all these conditions and more. And the conductor of this restorative symphony is a powerful gene called hypoxia-inducible factor, When this gene comes online, it improves oxygen delivery to the cells and activates over 100 genes responsible for cell survival and repair. This adaptive tool has been used by endurance athletes for a long time, via sleeping at high altitudes and holding their breath during training. Now take a wild guess as to why these athletes undergo this challenge. Exactly. It upgrades our ability to deliver oxygen to the cells. This process includes improved function in the heart, lungs, nervous system, blood vessels, and the mitochondria, along with an increase in red blood cells and blood flow to the brain. And for athletes, this means better performance and a higher likelihood to reach the podium. Plus, it also enhances learning and memory, just in case you're into that sort of thing. But we don't have to be elite athletes to reap the benefits of intermittent hypoxic training, because anyone could use this tool and improve their health, and in the process, prevent, treat, and reverse disease. To clarify the point, let's look at how intermittent hypoxic training impacts neurological disease. Curiously, most neurological diseases show a unifying pattern of decreased blood flow to the brain, impaired mitochondrial function, neuronal loss, and chronic inflammation. So doesn't it make sense to improve all these issues with adaptive action? Yes, and intermittent hypoxic training accomplishes this tall order and more by overhauling our oxygen network. This counteracts low blood flow to the brain and impaired mitochondrial function. This technique also unleashes a flood of nerve growth factors that protect and rebuild our nervous system, including the brain. Before we continue, I want to stress the importance of the mitochondria. It is believed that dysfunctional mitochondria are the main culprit behind aging and most degenerative diseases. And that's where the power of intermittent hypoxia comes into the picture, because evidence shows it will purge mitochondria that are slacking, rejuvenate mitochondria, and improve their function, as well as generate new mitochondria. Now, what about the last common factor of neurological disease? Inflammation. Remember how hypoxic conditions in the womb help develop our antioxidant defense system? Well, it turns out that intermittent hypoxia in adults activates this same system and increases our internal antioxidants. This in turn antidotes the mayhem of chronic inflammation. So why should you care? Because all major diseases involve chronic inflammation. Now I understand we just covered a lot, and it's hard to keep track of all the benefits. So just remember that intermittent hypoxia revamps our energy networks and improves overall function. To highlight this fact, consider what researchers are saying. Intermittent hypoxic training is an engineered natural intervention for preventing, treating, and rehabilitating chronic degenerative diseases. In fact, it's so potent that it's been recommended to treat all these conditions and more.